Thank you for listening to Here's to Your Health, a podcast brought to you by the Crawford County Memorial Hospital. During this podcast, we talk about healthcare, the people behind it, and the opportunities that help shape the next generation of medical professionals. This podcast is where we share stories, insights, and conversations focused on healthcare and the people who make a difference in our community. Thanks for listening to the Here's to Your Health podcast.
Welcome to today's Here's to Your Health podcast. I'm Brandi Ruskell, a marketing specialist here at CCMH, and February is National Cancer Prevention Month. So on today's podcast, we'll be discussing cancer prevention and the importance of preventative screenings. My guest today is Karen Olson, a certified medical assistant in the CCMH Medical Clinic. Karen's been here for 12 years at CCMH, and she works closely with patients every day supporting preventative care, screenings, and overall wellness. Karen also brings a valuable personal perspective to this conversation, which she's agreed to share with us today. So welcome, Karen.
Good afternoon. Thank you for having me.
So Karen, can you start by sharing a little about your role here at CCMH and what cancer prevention looks like in everyday healthcare?
Sure. Yes, I work as a medical assistant in the clinic, rooming patients, getting them ready for the providers, doing a lot of triage over the phone, helping patients to the next step, what they need to do. And as far as cancer prevention in everyday healthcare, it's really about screening and early detection and positive lifestyle choices like regular physical exercise, a healthy diet, avoiding harmful habits.
Mm-hmm. And if you're comfortable sharing, how has your personal experience shaped the way you talk to patients about screenings and prevention?
I highly encourage screenings. It's so important. Routine labs, mammograms, the screening colonoscopies.
So can you tell us a little bit about your experience?
I did have symptoms. I started with constipation, which was unusual for me, and then I got abdominal discomfort. So those were red flags that I needed to get attention.
And so for those that are listening and might not be aware, you are a colon cancer survivor, correct?
I am.
And how many months have you been in remission now?
October 29th was my last chemotherapy treatment, and I had my scans in December telling me that I was clear. We're going to continue to monitor, so in April I will go through all those scans again.
Okay. Well, that's wonderful.
Yes, I'm very happy about that.
Once you had your diagnosis, how did early detection or timing affect the treatment and recovery?
Yes, so due to my symptoms, I did present to the ER, and CT scan revealed that I had a mass. So Dr. Wright, our general surgeon, was consulted. He came in and visited with me. He made some phone calls, and I actually ended up having surgery that night yet.
Oh, wow.
Yes.
That's crazy. So a lot of people hesitate when it comes to certain screenings, like colon cancer screenings, colonoscopies especially, are uncomfortable for some people to talk about. What would you say to someone who's putting it off?
Please don't put it off. Don't be scared. Just schedule an appointment with your provider. Talk about it. They will guide you in the right steps to take next.
Right. I mean, I'm not even 40 yet, and I have had to have a colonoscopy due to symptoms. And, there are a lot of different things available now. It's not like it used to be, and there are tests you can do at home, so if you're uncomfortable, please talk to your provider about options. Beyond screenings, there are signs that people sometimes ignore. What are the warning signs or changes that you encourage people not to ignore when it comes to colon health or their health in general?
So basically any change in bowel habits. Blood in the stool, weight loss, weight gain, diarrhea, constipation, abdominal pain. Those are all things that you should take note and visit with your provider about.
And if you can just give us, just from your experience here at the hospital, what are some other screenings that we do routinely?
We do mammograms, the colonoscopies, the lab work, just a general profile, and we do those 4 times a year at the wellness. Those are all great options.
Yeah, and we do have a wellness coming up in March. I think it's the first week in March, if I remember correctly, so people can go online to sign up there. And I guess to wrap things up today, if someone listening has questions or concerns about preventative screenings, what's the best first step that they can take?
Make an appointment, contact your provider, and talk it over.
Absolutely.
Prevention is not a guarantee, but it significantly can impact your cancer risks and outcomes.
Right. Well, thank you so much for joining us today, Karen. We truly appreciate you taking the time to share your knowledge and your willingness to talk about your experience. And for any of our listeners, remember that small proactive steps do make a difference. If you have questions about cancer prevention or need to schedule a screening, please talk to your primary care provider. And you can schedule an appointment here at CCMH by calling 712-265-2700 or by visiting us online at ccmhia.com. Thanks for listening.
Thank you for listening to Here's to Your Health, a podcast brought to you by Crawford County Memorial Hospital. We hope today's episode provided helpful information and a better understanding of the care and services available in our community. Be sure to join us next time for another conversation on Here's to Your Health.